Good evening. It's Dr. Daniel Cameron. Welcome. This is the eighth session I'm having. You may have noticed I'm changing the title to Lyme Disease Science Conversations, formerly Lyme Hangout. And the reason I'm changing to Lyme Disease Science Conversations is it allows me to broaden from just the treatment, from just tests, to what is really happening with Lyme disease. So I'm Dr. Daniel Cameron. I'm been in practice in Mount Kisco, New York. I continue to practice for the past 31 years. I enjoy my practice, but I also enjoy learning about Lyme, learning the science of Lyme. Every day there seems to be a scientist that's doing a lot of work, publishing great material on Lyme disease that we really need to know. And I wanted to spend some time through this format to share what I have learned in my practice and share with my listeners what they have learned through the comments section. So stay tuned with me as we work through this format. The other thing for the Lyme disease science conversation format is that I will anticipate doing interviews with leaders in the area in the future. So once this gets going, it offers a lot of different ways of discussing the science of Lyme disease. So I thought I'd give you this introduction as you're getting ready, as you're logging on. Now, when you look at the screen on the website, Daniel Cameron MD, you'll see the live feed, and you'll see on the right-hand side of the page some of the text I'm going to be referring to. Topic tonight is guidelines for treating tick bites. This is a very important topic at this time of the year for the Northeast because spring is here, allergies are here. You may even be able to tell that I have some allergies. I have a little congestion today. So I'm in my home, I'm comfortable, fighting a little bit of allergies. So bear with me if I tend to be a little bit congested. So in the Northeast, United States, there's ticks. Many of you have seen spring a little earlier, especially in the South. So you very easily could have seen ticks in the spring. In fact, in the deeper South, during the winter, often that's when there's tick bites. That's when you need to really pay attention to ticks. But because it is Lyme awareness, the United States picked Lyme Awareness Month as May. It seems like an appropriate time to do a little refresher on ticks. What do we have to worry about in the ticks, and what might be the best way to treat a tick bite? So I'd like to do is just spend a few minutes trying to see if I can share some pictures of ticks. So if I look at the website, and that not everybody's going to have a tick like this. This tick's fully engorged. There's probably 20% chance, maybe much higher, that you're going to get Lyme disease from that tick. Now, not every tick has infection in it, but many of them have. If it's a nymph, at least 25% in the Northeast have spirochetes. If it's turned into an adult, then it ends up being 50% chance of having Lyme. But there's, at this point, so many other things in a tick. So I wanted to first spend a little bit of time looking at a tick. So one thing is, if you look at just a Google search and look under deer ticks and look under images, you can very easily just get a little bit of information. So bear with me as I sort of point out some of the things that I like to look at. Just this very first picture alone from the Tick Encounter Resource Center is that itself is an adult female deer tick. And this is probably the most photogenic of all deer ticks. It's also called Ixodes scapularis, black-legged tick. And that tick's a pretty good size. This is the male, which tends not to bite This is the nymph right here. But you see there's different colors. Larvae bite, but don't typically have the infection in there. Now, that there's some exceptions. Sometimes larvae actually have some of the other types of tick-borne illnesses. This over here is a blown up tick. This over here is, you see how fat that one is? That means it's fully blown up with, do you see it? It seems like I've been notified that you don't actually see my screen. So I'm going to try this other screen. Can you see my screen now? There. Can you see it now? There. Can you see it? Okay. So it looks as if the technical qualities is that you can't see, it looks like the audience is not seeing present to everyone. How about now? Can you see it now? Can you see it? Okay. So how about if I present without a tick? You don't see it on the screen? You see it? Okay. So if you can see the ticks on the screen. Is that tick's engorged? If one looks a little further, that's a deer tick. You see the black shield that's behind there? And of course, that's perfect condition. You take the tick off, and you can see the tick. Now, if you go down to this screen, you see adult, the nymphs, the nymph is here, and the larva. But you see in real life, when you see over here, this tick that's engorged, slightly engorged in somebody, it's pretty hard to be an entomologist and be able to understand that particular tick. Okay, so if I go back down here to these, a few more of the ticks. Let me go back and get through the technical aspects of this again. So if I go back and see, wanted to show one more thing. You see, as you get smaller and smaller, one thing I want to be aware of is that you get closer and closer on these ticks, and they're going to start looking a little bit different. That's a black-legged tick, a western tick, a deer tick. If I go to this one over here, you see they can get pretty small. So evidently, the other thing I wanted to show is that even though that's a deer tick, that's a dog tick with the brown and white camouflage. And then that's if one looks at the Lone Star tick, they have a white dot behind its back. And so what I can see is that in the challenges of working with ticks is that I'm having a little bit of technical qualities. Next time I'll get this thing a little better. But the most important thing to be aware of is they make great pictures on the internet, but when you have a tick on you and you're wondering what's in a tick, you're not going to know if there's an infection in that tick. The deer tick has the most and the broadest range of infections in the Lyme world. If I go to back and let me talk to you directly, is that when you get these kind of ticks and work with these kind of ticks, is that Lyme is in there. And so you try to think what else is in there. And we always hear about Babesia, which is a parasite, Ehrlichia, anaplasmosis, and the same thing in cat scratch fever called Bartonella is in there. But lately, the CDC this week came up with a paper that said that in this paper, it said there were 7 new infections in the tick population in the United States that have been identified since 2004. So there's the 2 viruses like the that are out there that are causing troubles, and the Powassan you've always heard of in the past. In this case, is that there's a new sets of viruses that are out there. The one is called the Heartland virus, Bourbon virus. There's also a something called Borrelia miyamotoi that used to be thought it was just a bacteria that just happened to be in a tick. And now they realize that it's a serious infection, not just in Japan, not just in Russia, but the United States. There's also some new rickettsia. So instead of just Rocky Mountain spotted fever, there's other rickettsias and Amurus type bacteria. Most of those bacteria are all susceptible to doxycycline. But besides just naming all the pathogens in there, I think the crucial point of discussing treatment for a tick bite on today's science conversation is this question of how long does it take for a tick to transmit disease into your child or your body if you get bit. So when you look at this CDC recommendation of waiting for 36 hours before you get transmission, I went back to try to figure out where did the 36-hour rule come from. And where that 36-hour rule came from was a study in the year 2000, 18 years ago, where they took mice and they wanted to see how long did it take for an infection to be transmitted to a mouse. So they took around 60 mice and they put ticks on them, and they were able to show that it took at least 24 hours before a tick would give the disease to the mouse. So they less than 24 hours, the mouse was fine. More than 48 hours, the tick had a chance of getting infected. In fact, at 2 out of 16 mice got infected. And so they figured, well, let's pick 36 hours because it's halfway between 24 and 48 hours. So the 36-hour rule came not from a man, it came from a mouse. And it's how long it takes for that mouse to get infected with a tick. So that continued public health message of waiting 36 hours is somewhat confusing if it's based on a mouse. You'd think they would do more research than that over time. Once you pick a 36-hour rule of how long it takes for an infection to get into a mouse, then they try to find out why did that happen. And the theory is that the tick hides in the mid-gut, in other words, the belly of the tick. The tick bites. The tick picks up some blood. The infection multiplies and then goes up into the salivary glands. And then during the bite, the salivary gland gives the infection to the mouse or gives the infection to the person. So that's where the 36-hour, it takes time to get from the gut all the way to the mouth. The problem is that just because it takes that long for a mouse to get infected, not all species are the same. And the concern is just because they pick 36 hours, what happens if a smaller number of bacteria get up into the salivary glands and into the mouth of the tick that give infections to the mouse or give an infection to you? I certainly in practice have always wondered why people seem to have an infection and the tick was not engorged or wasn't on very long. I used to think it's because the tick had already bitten a mouse or bitten something else. But looking at this study, it's always possible that this a partial infection might have gotten into the mouth of the tick and into the person, and that's why the infection doesn't take as long to come in. I think that if you look at the 36-hour rule, is that the reason that's so important is that the public health people are saying that, oh, just wait 36 hours. But I still always, as a doctor, find some people seem to get infections in less than 36 hours. So I think you still have to use common sense. That if someone's sick after a tick bite and it hasn't been on 36 hours, pay attention. If they get a rash, you got to pay attention to what's going on with the with that tick. But there's another aspect of it is that the 36-hour number, which I hold suspect, is just for Lyme. That same mouse study, they were able to show Ehrlichia was able to be transmitted in less than 24 hours. In another study, Powassan could, as a virus, get transmitted in minutes. There's some concerns that Borrelia miyamotoi can get transmitted rather quickly and quicker than the 36-hour rule. So I think we're dealing with old data on transmission time is we can't be as comfortable as you were in the past about not worrying about a tick. I worry about every tick, at least pay attention to the tick. Now, if somebody comes in with a tick to me, I remove it. Most important thing is to get that tick off. Now, you shouldn't be grabbing that tick by the belly, because if you grab it by the stomach, you might push the bacteria out of the midgut into the salivary glands into you. So you try to get it by the head. Now, sometimes there's a small mouth part that's left in the area, even though it looks like everything's gone, looks like it's all taken care of. It's hard to get that mouth part out because it's bonded in with a glue type material. There's a barbs on the mouth part. They say you don't really have to get it out, but I always like to get it out if I just happen to have someone in my office. Now, the next question comes is should you treat every tick bite? Now, in the past, Dr. Nadelman and some of his colleagues thought, well, why don't we treat one group of patients for a tick bite and another group with a placebo? So for some reason, they picked 2 doxycycline pills. Each pill was 100 milligrams. So they picked 200 milligrams one time, just that day of a tick bite, or at least within 3 days of having the tick bite, and that was it. So they compared the group that got 2 doxycycline pills and another group of patients that got placebo to see if that would prevent Lyme. Now, of course, doxycycline was tested against Lyme. It wasn't tested against any of the other co-infection. So they found the group that took 2 doxycycline pills had less rashes. So it was like 8 rashes in the placebo group that didn't have anything, and 1 in the treatment group. So they said, that's great. We reduced the number of Lyme cases from 8 in one group to 1 in the other group. So that was statistically significant, barely significant. But what I wanted to point out is that that they thought, well, that seems reasonable, even though the other trials before this, treating a tick bite didn't seem to be effective. For 10 days, a 1-day treatment seemed to work. And so that caught the attention of the Infectious Disease Society of America. And the Infectious Disease Society of America said, well, why don't we pick prophylactic treatment as 2 doxycycline pills? Why don't we just do it that way and adopt that? Now, it happened to be that Nadelman's group that did the doxycycline trial was in the same medical center as the Dr. Wormser did the Infectious Disease Society of America guidelines. And so they adopted that. So if you choose to treat a tick bite, they adopted 2 doxycycline pill, that's it. Now, I have my concerns in practice, but in my practice, I also work with the Infectious Disease Society of America. counterpart, which is the International Lyme Associated Disease Society, ILADS. And that society, we worked through the evidence and we came to a different conclusion. So if I look at my book, Lyme Disease and Medicine, if you look at that in that book under section 103, I was addressing with that group what are the problems if you take 2 doxycycline pills. So if you take 2 doxycycline pills, it was not designed to detect Lyme disease if there was no rash in the first place. It was not designed to detect chronic or late manifestations of Lyme because they didn't observe patients more than 6 weeks. So they didn't look to see if you could get neurologic Lyme, chronic neurologic Lyme, neuropsychiatric Lyme, any other manifestations of Lyme. They were just looking, could you prevent a rash? In my practice, I just want to be able to prevent any complications of Lyme or any chronic complications of Lyme. It was also not designed to see whether doxycycline would work for other tick-borne illnesses like Ehrlichia, anaplasmosis, or Borrelia miyamotoi. In this case, it was only for Lyme disease prevention, not anything else. And so what ILADS decided to do was that if you choose to watch a waning, then you should have them come back for a follow-up, do some blood tests and a follow-up. And during that visit, if you choose not to treat, clinicians should educate patients regarding the prevention of future tick bites, what early Lyme is, what late Lyme is, the manifestations of other tick bites, other tick-borne diseases. They should be supplied what are the treatment recommendations if they get ill. I always tell them if they get ill in the next 6 weeks, is make sure they get in sooner than just the normal scheduled follow-up. The other thing the ILADS guidelines were concluding was that if you do treat for Lyme disease on a prophylaxis basis, you should use 100 milligrams of doxycycline 1 or 2 twice a day, just like you might for a rash. And then you have other treatment options based on individualized therapy. If they have something else going on, like they have sweats, you might be thinking about Babesia at the same time. But you should, if you're going to treat like you would a rash. If you're not going to treat, then you should have them come back. So this is very important because I still see patients coming in where they get the 2 doxycycline pills and they've done well. But once in a while, you get somebody where they take the 2 doxycycline pills and they didn't do well. Sometimes they actually have something in between. They actually have an erythema migrans rash. The rash is over 2 inches in diameter. It's classic Lyme, but the doctor picks 2 doxycycline pills instead, where they should really be treating anyway for Lyme disease. Now, because of the of guidelines, it's very easy to say, well, I'm going to treat with 2 doxycycline based on a guideline. If you do, that's the Infectious Disease Society of America. If you treat longer, that's either ILADS or it's your own judgment. As a doctor, you don't always have to rely exactly on either guideline, but pay attention to the patients. That's what I do in my practice. Now, recently there was a paper that came out for those who are very aware of ticks, that if you look at the Scootle index, that is, if you look at the belly of the tick and look at the size of the belly, and the belly has not gotten swollen enough, you might say, well, they haven't been biting very long. But I find that even as much research as I've done, as much as I've been in practice, I don't have the ability to look at the underbelly of a tick and judge how much blood is in that tick until they get a decent size. In practice, when it comes to a tick bite, is that I want to add one more pearl, which is that the assumption is that you're going to get bite, you're going to get Lyme disease, you're going to get a rash, but there's more and more people where they don't get a Lyme rash. They just go on and have Lyme anyway, or they don't get Lyme in the first place. They might end up with what they call a co-infection. Sometimes they're not happening at the same time. So um, one of the cases that I discussed in my book had to do with in the preview 3 section, which is toward the end of the book, is that this this is a case of 2 different women, both got Lyme disease during their 3rd trimester of pregnancy. They both presented with a Lyme rash. So they weren't treated exactly at the time of the tick. They were treated at the rash. You know, not every pregnant woman sees a tick. They got treated for Lyme. They delivered a baby, healthy baby. The baby went home. And then on the follow-up, several weeks later, they ended up with babesia, with parasites in their red blood cells. And so in practice, when I'm so used to having everything happen at once with a tick bite, they may stagger. So the case of these 2 infants that had babesia weeks after their onset of their Lyme means that it's very important to follow up people. If they get a tick bite, follow them up. If they get a rash, follow up. If they get anything with Lyme, follow up. This is such an important illness to address that you want to stay on top of it. And so the other thing I want to remind people is that I find that when you look at ticks, study ticks, and they tell you what's in a tick, is that ticks are moving, birds are moving ticks around, animals are moving ticks around. Sometimes just when we think there's none of those ticks in our area, the Lone Star tick shows up in the Northeast. Ticks that have babesia in the West Coast show up in the East Coast. Those that have babesia microta in the East showed up in the West Coast. And so just when you think there aren't any ticks or there are no infected ticks, be aware. There's more and more studies in Canada that there's a lot of tick. There's one science blog that I wrote a couple weeks ago about hundreds of ticks in the backyard of one of the science citizens. They brought him in on the flowers, on the cat, and on dragging their yard. There's studies in Kentucky recently which shows rickettsia and Lyme disease in a lot more counties than they suspect. So it seems like as you get more and more people looking, you're finding infections. In the deep south, they're finding more and more ticks and more infections. And sometimes the ticks don't always look the same. So at the beginning of my talk, I was trying to show you the diversity of ticks that are out there. In practice, when you got one tick with you, it is confusing to look at the kind of ticks and try to figure out what's in a tick. So ultimately, no matter what you read about guidelines, is that you still have to be a doctor, listening to the patient, trying to make decisions, the best decisions. In summary, in terms of treatment, I tend to use doxycycline if I can for a tick bite because it kills almost all of the infections that are in a tick. It doesn't work for babesia. But when I said almost all, almost every study shows there's some people that have different strains, different types of infections. And you have to stay tuned because there always seems to be somebody that isn't getting well with a standard type of treatment. You can't rely on tests that well because we don't measure the infections that often in a person. All we can do is measure antibodies. So you often run into these complicated situations like, should I treat a child with doxycycline for how long with doxycycline? And there's been some studies recently that doxycycline for 2 weeks for Rocky Mountain spotted fever did not lead to any graying of the teeth. Now, that doesn't mean there won't be future studies looking at the role of doxycycline and the problems with doxycycline. If someone still has problems, doxycycline doesn't work, and they're still sick, then I sometimes use other drugs like amoxicillin and zithromax. So I think if you look at it, this time of the year, Lyme Awareness Week, is that we're just beginning to work out in this format. How I can spend some time with you as sharing some thoughts, sharing some challenges, sharing what we do with a tick bite. And, it often is hard to figure out just by reading on the internet or reading some public health message. In real life, a tick has been on a mouse, may have picked up a wide range of infections, may not have. And we like to take every tick bite seriously in our practice. And I think that as you go through the summer, there's all kinds of discussion about when are the ticks out. They say nymphs are out more in the certain times of the year, and adults are out later, but ticks hang around for a while. And so that just because they make a nice graph of when they're on, when they're out there, there's so many different parts of the world, so many different parts of America, that sometimes these ticks aren't always out there at the same time in one location. As the climate changes, there seems to be different times that the ticks are out. Sometimes they're out earlier. Just stay tuned when it comes to tick, because whatever I tell you today is bound to change over time. So I think that this particular edition of Lyme disease science conversation is taking on different subjects. The past subjects included teens with Lyme, anger, irritability in Lyme, myocarditis, babesia, and this all-important post-treatment Lyme disease syndrome, which I don't like the term of. I don't like to stop treatment and call it post-treatment Lyme disease syndrome. If you stay tuned, if you stay with me, is that we'll keep working on design issues so that I can leave my office, leave my practice, come home and take on topics like this. Hopefully, as the technology improves with the internet, as it improves with these types of conversations, that we can have formats that'll be better and more seamless. If you missed this particular presentation, it'll be on the same Daniel Cameron MD website. It'll also be on YouTube on my channel, so you can easily access this later if you need to, or if you get bit, don't forget to do this. I'm going to spend a few minutes to see if there's any questions that came up from the. So let me see. These are in the comments section. So this one was same up from Texas. To see you this past Friday. Dr. Okay, in this case is that they had seen me, but in this case, you have to be aware that just because there's, I work with Lyme here in the Northeast United States, is that sometimes it gets difficult to find a doctor familiar with ticks in other parts of the country. So years ago, I was fascinated because when they were in Mississippi, they did a study and they took ticks off people who came in with a tick bite, and they were finding Ixodes scapularis, which is the deer tick, in Mississippi, but they weren't finding it in the summer. They were finding it in December, January, February, and March. And so I thought that was interesting, is that what good, healthy-minded tick would want to be on a dry Texas blade of grass, or Mississippi dry spell? Why not wait for better climate, better humidity, and so they can come up. And that actually was subject of one of my science blogs. Is they were able to show that a tick in the south in that kind of atmosphere could easily go up and down more when it's humid and the temperature is cooler. Whereas in hotter and drier climates, the tick tend to stay down close to the ground. And it would suggest in that study that the typical Yankee concern of ticks only in the winter, sorry, to ticks, the Yankees always that are in the summer where I live, but in other parts of the country depends on when the ticks are active. So this particular question shows that even in Texas, there's been an increasing number of ticks. There's a couple of yeses that came in. Yeah, here's another comment. We Lyme patients are, I think, one of the most informed patient populations, but we're powerless in our knowledge for the most part, and many are too sick to advocate for ourselves. How do we get doctors in every branch to learn about Lyme and co-infections? How do we get clinics to meet our needs? My mega clinic doesn't allow doctors to do any of these three things. Well, that reminds us that we need new formats like this. The book, the reason I put the book Lyme Disease Takes on Medicine is to put together a lot of the science blogs that I do. It's to get readers to understand Lyme a little, but there's so many others out there that are learning Lyme, understanding Lyme. Is how do we collectively get doctors emboldened? There's plenty of doctors who are out there who see Lyme patients, but there's some frustrations because they'll see a guideline that says don't treat, and then a guideline that says treat doxycycline pills, and the medical board sometimes say, well, why don't we wait? Why don't we not treat for now? And so this particular comment is expressing the frustration of a growing number of problems with ticks, a growing complexity of ticks, and I'm all about dialogue. Can we get a communication going? Can we get something going that will allow us to be able to trust that if you get a tick, that if you get a rash, if you get chronic manifestation of Lyme, that you can find somebody in your neighborhood, somebody who you know, who can take it on. You know, even if doctors are divided, you want to have enough doctors who are comfortable taking care of you to it. And so thanks for that particular comment. Now, we didn't have too many comments today because sometimes we had a lot more, but I think if I pull this together is that this is a format to try to bring the articles that I read, the science that's out there to you to begin to discuss this all important topic of a tick bite. I think that when we look ahead at future forums, where there's going to be a lot of topics to discuss. I'm excited about it. In the future, in about June 9th, which is a Saturday at 4:30, I'm going to be having a book signing. So that'll be my first official book signing. I don't know if you can see it. Lyme Disease Takes on Medicine. And instead of a doctor, I'll be an author that day. I'll be sharing some time with those who can make it to the June 9th. It's in Mount Kisco, New York at 4:30. I'm pretty active on Instagram, on Facebook, and I have a YouTube channel. So like me or become a member of the YouTube channel. Just join the conversation, because just because I'm involved, many of you are involved, and we're all on the same page of trying to get the dialogue going, to get an understanding of every topic. This topic, just this topic alone, just a tick bite, happens to be fascinating as how did we get on this 36-hour bandwagon. I'm not comfortable with 36 hours. And I think that on every topic, there's always something that we can work out and try to get to a better answer. So I appreciate the opportunity to spend time with you this evening. And thanks. And those who are having troubles, keep strong. I'm there for you. I'm there with you. I know it's tough sometimes to hang in there and see where there's not too many answers, but persistence help. You got to fight for being well. Good evening.